What I had noticed about a year ago is our patient satisfaction measured by Press Ganey through HCAHPS, which is what we have to report to the federal government, had dropped over the last several years from about in the 50 percentile, which wasn't great but not horrible, down to the 10th percentile. I meet with the residents every week. How is their education going? What are they learning? What do they need to learn? What do they feel like they're missing out? So I took this problem to them and said, look, our patient satisfaction is not good. We're doing the same thing with all the other docs in terms of teaching the habits about knocking, sitting down, all of that. But what else is going on in the residency? How are you spending your time? And what they said was a lot of their time is spent looking for care managers. Our patients were scattered throughout the hospital on every floor. We do deliveries, newborns, so we're in the ICU, we're on the 5th floor, every floor in between, and every floor has a different care manager, and a lot of time was spent walking around the halls or making phone calls instead of with the patient. And so that idea came to me then about adding a care manager to our team and having all of our patients in one area of the hospital, and that's how this program developed.
So she hatched the idea of defragmenting this process, cohorting patients in one part of the hospital, adding other key members to the team like a progression coordinator from care management and the key nursing personnel. This was a staff-driven, faculty-driven idea. It was just my job to facilitate it come to fruition.
I think what's unique about it is that we have other non-physicians rounding with us. And so when we're going on our morning rounds with our attending, Kristen Stewart especially, our social worker, is there with us. That way any problems that we foresee or that come up during rounds can be addressed right there and then.
My title is Progression Coordinator, and it really literally is helping the progression of care for the patients. So when I'm working with the residents and we're highlighting needs for patients, I'm right there trying to implement that. Now that we have the interdisciplinary team, set, I think that it's been a lot easier for patients. They know their discharge plan when they leave. They know their day-to-day care. It's discussed at length at bedside what the plan of care is for the day.
The patients really like the approach that we've taken with this new program. They like seeing the doctors, the nurses, and the case manager working together there at the bedside. Communication has increased tremendously, and that is a huge, huge positive. It's a win-win for the team, for the doctors, the patients, the nurses, that we all work together well.
It's definitely improved the quality of patient care and their satisfaction as well. I hear a lot of patients telling me that they love being taken care of our team. They realize that everyone's coming to talk to them, everyone's coming in to address all of their problems.
Well, we launched the program in the first part of 2014. In the teaching service, the residency program was at the 10th percentile, the bottom decile, and they're going to finish the year at the top decile.
If we look at the outcomes that we've had, our length of stay has gone down, even though our patients are more complicated and our expected length of stay is up. Our mortality has gone down, and probably most dramatically our readmission rates. Readmission rates have more than halved in this same time period.
At Oakwood Hospital Wayne, we've committed to innovation, and this program was one of those initiatives. So it is being piloted at other hospitals, and we're looking to bring this program to all the patients at Wayne going forward.
It's not just about the patient being satisfied, it's about the patient getting the care that they need, getting the right care, and going home and staying home and doing well at home or whatever care setting they go to.
With this program, it really isn't anything different than what family medicine should be.